if your hands or feet feel like they're being pricked by thousands of tiny needles, if you wake up at night with burning, tingling, or numbness that just won't let you rest, if buttons feel harder to fasten, cups slip from your grip, or walking feels less stable than it used to, please pause for a moment and listen carefully. What I'm about to share has helped many people over the age of 60 reclaim sensation, balance, and confidence, sometimes in as little as 2 weeks, using something simple, affordable, and often already sitting in their medicine cabinet. My name is Dr. Sandra Serrati, and for over 15 years, I've worked closely with older adults suffering from nerve damage. I've treated hundreds of patients who were told their symptoms were just part of aging, and what breaks my heart every single time is this truth. Most people living with tingling, numbness, burning pain, or weakness have no idea that their nerves are starving for one essential nutrient that correcting this deficiency can dramatically change their quality of life. Today, I'm going to explain what is really happening inside your nerves, the one B vitamin your nervous system desperately needs, why most seniors don't absorb enough of it, the biggest mistake that prevents recovery, and exactly how to take it safely and effectively for nerve repair. Before we go any further, I want you to ask yourself something important. Do your hands or feet tingle when you lie down at night? Do you struggle to feel hot or cold water clearly? Do you feel unsteady when walking, especially in the dark? Are you dropping things more often than before? Or do you experience a burning sensation in your feet that feels worse at night? If you answered yes to even one of these, your nerves are sending you a warning signal. And here's what most people and even many doctors don't explain clearly enough. This isn't just uncommon. It's not harmless. And it's not something you should ignore. Untreated nerve damage can lead to permanent loss of sensation, increased risk of falls, loss of independence, and a serious decline in daily quality of life. But the good news is this. In many cases, nerve damage is not permanent, especially when caught early. Let me explain what's happening inside your body right now. Your nerves are like an incredibly complex electrical network. They carry messages from your brain to your hands, feet, muscles, and organs and back again. Every movement you make, every sensation you feel, depends on these signals traveling smoothly and accurately. To protect these delicate nerve fibers, your body wraps them in a special insulating layer called the myelin sheath. Think of it like the plastic coating around an electrical wire. When that coating is healthy, signals travel quickly and clearly. But when it breaks down, the signals leak, misfire, or slow down. That's when symptoms begin. Tingling, numbness, burning, pain, weakness, poor balance, loss of coordination. Now, here's the critical part. Most people never hear. After the age of 60, your body becomes much less efficient at maintaining and repairing this protective nerve coating. And without the right nutrients, the damage accelerates. There is one specific B vitamin that plays a central role in protecting and rebuilding this nerve insulation. That vitamin is vitamin B1, also known as vitamin B1, is absolutely essential for nerve function. Without it, nerves cannot produce energy efficiently, cannot maintain their protective coating, and cannot repair damage with enough B1. However, nerves have an incredible ability to recover. I've seen patients who couldn't feel their feet regain stability. I've watched people who dropped cups daily regain hand strength. I've seen individuals who thought their active days were over return to gardening, cooking, sewing, and even dancing. This isn't a miracle. This is biology giving your body what it needs to heal. Think of vitamin B1 like oil in an engine. You can have the best car in the world, but if you never change the oil, friction builds, parts grind down, and eventually the engine fails. Your nervous system works the same way. Without B1, nerve signals slow down electrical messages, misfire sensation becomes distorted. Muscles weaken, balance suffers with adequate B1. Nerve energy production improves. Protective insulation rebuilds. Signals become clearer. Sensation gradually returns. Many people describe it as waking up parts of their body they thought were gone forever. Now you might be thinking, I eat well. I probably get enough B vitamins. Here's the uncomfortable truth. A large percentage of adults over 60 are deficient in vitamin B1, even if they eat a balanced diet. Why? There are 3 major reasons and almost no one talks about them. First, stomach acid decreases with age. Vitamin B1 requires adequate stomach acid for proper absorption. After 60, many people absorb less than half of the B1 they consume. Same food, same vitamins, less absorption. Second, many common medications silently deplete B1. These include diabetes medications, especially metformin, water pills, diuretics for blood pressure, certain heart medications, long-term acid-reducing drugs. These medications are helpful, but they come with nutritional consequences that are rarely discussed. I've seen patients on these drugs for over a decade without a single B1 test. Third, modern diets are low in natural B1. Food processing removes it. White bread, white rice, packaged foods nearly empty. Let me share a real case. A patient named Robert, age 71, came to me with worsening numbness in his feet. He was active, careful with his diet, and walked daily. Yet he felt like he was walking on thick socks all the time. He couldn't feel the pedals while driving. Blood test revealed severe B1 deficiency. The cause? A diabetes medication and a water pill he'd taken for years. Within weeks of correcting his B1 levels, sensation began returning. He told me it felt like the lights came back on. And he's not alone. Now here's where most people make a critical mistake. They take the wrong form of vitamin B1. Standard thiamine is poorly absorbed and quickly eliminated. What nerves need is a fat-soluble form called benfotiamine. Stays in the body longer, penetrates nerve tissue more effectively, supports myelin repair, is far more effective for neuropathy when choosing a supplement. Look carefully at the label. You want benfotiamine, BMOTIMINE, for nerve repair? The therapeutic dose is 150 to 300 milligrams daily. Vitamin B1 is water-soluble and extremely safe. Your body uses what it needs and eliminates the rest. Take it with food, preferably breakfast, and include a little fat for better absorption. Consistency is everything. Mistakes and progress slows. Now, let me tell you about Margaret, the 67-year-old patient I mentioned earlier. She came to me terrified. She couldn't feel her grandchildren's hands. She dropped dishes constantly. She'd fallen twice and feared losing her independence. She had been a professional seamstress for decades and suddenly couldn't button her own clothes. Her B1 levels were dangerously low. We started 300 milligrams of benfotiamine. Within 14 days, sensation began returning. Within 6 weeks, she was buttoning her own shirts. Within 3 months, she returned to sewing. She told me, "This gave me my life back." Before we finish, 3 important warnings. Always get blood work. If possible, consult your doctor. If you have kidney disease or multiple medications, B1 works best with B6 and B12. A high-quality B complex with B. As benfotiamine B6. Same. MGB12 1000, MCG produces the best results. Your body is capable of healing. Your nerves want to recover. Have you noticed that nerve symptoms often feel worse at night? There's a reason for this. When you lie down, distractions fade. Your brain becomes more aware of faulty nerve signals. At the same time, circulation slows slightly, making nerve weakness more noticeable. This is why burny feet, pins and needles, and electric sensations often peak when you're trying to sleep. It's not in your head. It's your nervous system struggling to send clear signals without proper support. Your body was not designed to fail you at 60 or 70. It was designed to adaptive. It's properly supported. Nerve damage is not your fault, but recovery is your responsibility. And it starts with one simple step. You just need to give them the right support. If this helped you, share it with someone over 60. Subscribe for more Senior Health Guide.